Hello, everybody. Thank you for inviting me to participate in this conference. It is both a pleasure and an honor. The plan was for me to participate in person, but unfortunately, due to other plans and obligations in the US, I wasn't able to travel to Malaysia. I would still like to thank the leadership of this conference and the organizers for allowing me the opportunity to still participate through this video. I wanted to start this presentation by talking a bit about myself as an immigrant from Iraq to the United States, and then talk a bit about what Blumont does and our work in the countries that we operate in. I will also touch upon the factors that affect the well being and the health of the migrants, and we'll finish off this presentation by some food for thought. I migrated to the United States from Iraq when my company transferred me from the Baghdad office to the DC office. Unlike a lot of migrants, I had the luxury of having a job. I had the language skills. I had the social network. I had a lot of support from a lot of friends in the States. And irrespective and in spite of all of that, I still felt overwhelmed. I felt that this is a challenging situation, both socially, economically, and psychologically. Not a short time after coming to the States, I was diagnosed with cancer. That was one of the huge milestones in my life. Coming to a new country, being diagnosed with cancer is definitely not an easy journey or challenge that anyone would face, especially since I was new to the country. I did not understand the health system. I did not understand how to, schedule an appointment for the doctor. I did not understand what I needed to do in terms of the medical procedures. How do I make decisions? So it was a huge challenge. Lucky for me, though, that my company, IRD, Blumont, had an excellent health plan that covered the majority of the cost of all the long procedures and treatment that I went through from 2013 to 2017. I want you to take a moment here to think about what about those migrants who are not unlike me, who are unfortunate, who do not have the language set, who do not have the luxury of finding a job immediately after they arrive into the country where they migrate into. Or even if they did find a job, it will be a low income job. They have to accept anything to be able to survive. I want you to think about those migrants who do not have any support system, no community and social network. Let's table that for the end of the discussion. Through the work that Blumont does across the world, we operate in the Middle East mainly. We operate in Latin America, Pakistan, Afghanistan, and some parts of Africa. Through our works with the refugees and the internally displaced persons and the vulnerable communities, specifically in the hot zones right now in Yemen, in Syria, and in Iraq, we saw that there is a lot of vulnerable population that face forced displacement, family separation, trauma related to their new status as internally displaced persons and refugees, lack of access to service, lack of civil documentation. A lot of those people, when they cross even from one country to the other, they do not have their own documentation to prove that they are citizens of the country that they left. There is also an increased risk of protections, including increased sexual and gender based violence. The challenges that those refugees face might vary from one country to the other. In some countries, they're provided with complete freedom. They can move however they want. They can leave their camps. If they're allocated in camps, they can also rent apartments if they are able. And they can find jobs. But in other countries, they're confined to camps. They're not allowed to leave those camps. Therefore, it is very challenging for the refugees or the internally displaced persons to even have the dignity of finding jobs and living their life. Therefore, in Blumont, what we do is that we focus on enhancing community-based protection. We build the capacity of the vulnerable communities and groups and support them in obtaining their rights and safety and dignity. We conduct a lot of community-based protection, which implies that communities, through consultation and participation, engage meaningfully and substantially in all the aspects of these interventions. We also play a leading role in the change. What do those refugees and those internally displaced persons want? It might be, we might think that this is such a temporary thing, but it is not. In most cases in those countries, it takes years and years for those people to be able to even go back to their countries if they want to go back. Therefore, they're forced to find jobs. What we do also is that we established governance committees in, let's say, the camps that we operate in to support us in identifying the needs and addressing those protection aspects that I spoke about. We also train the protection volunteers that we have, whether in the camps or in the neighborhoods that we operate, in conducting household visits, managing and referring cases of IDPs as needed. We also train them on, finding more specialized care for the more advanced cases of any trauma or psychosocial needs. We also raise awareness on human rights, women's rights, human trafficking, the prevention and response to sexual and gender-based violence. We do so by building the capacity of community members to design, initiate, and implement awareness-raising activities. Those activities include such as plays, storytelling, arts, shows. What we also do is support the refugees and IDPs in adopting a healthy coping mechanisms, as healthy as it can get, through promoting anger management, improving stress releasing mechanisms. We also tend to focus on, when possible, engaging the IDPs and the refugees in finding jobs, training them for their livelihood. And we provide cash for work opportunities, vocational training, and we follow that by financial literacy and business training and seed grant and apprenticeship. We also have facilitated job placements, subsidized salaries, or provided support to businesses that encourage businesses to hire the refugees and the IDPs. In all this work, we focus mainly on working with the local government, the local communities. Our approach is bottom up, not top down. We focus on that because it is important that the community that hosts the refugees or the IDPs accepts the responsibility of working together with those IDPs and refugees, accept them, assist them whenever possible. That doesn't mean that we exclude the host communities. On the contrary, we also focus on the host community, as definitely any refugee crisis or IDP crisis puts a lot of strain on the host communities from an economic standpoint or even a social pressure, which in a lot of cases can be the roots and the cause of any potential conflict. Definitely, we're not alone. In all our work, we work with other partners, whether international organizations or the donors, whether it's the UN, whether it's the US government, and other donors as well in all of the intervention that we work on. This brings to mind, you might say, okay, so you're talking about refugees and IDPs. What are the factors that impact the health and the well-being? I think to summarize the factors that impact those is the chart that you see right now. There are 4 stages of what are the factors that impact the health and the well-being of migrants. There is the pre-migration phase, where even when you want to make it, if it's a willing migration, then there is definitely a phase where the person decides or the family decide that they are going to migrate, and that creates a lot of pressure and creates trauma for all the family, including the person, if it's one person traveling or not. And then there is the movement phase, when you're crossing maybe countries, when you're actually on the move to migrate. and that has its own trauma. It's the duration, it's the circumstances, the condition of the journey itself. And then there is the arrival, when that migrant arrives to the country. It depends on how he's going to be received. What are the policies? What is the legal infrastructure or structure of the country that he is going to, or the family is going to? What is there a social cohesion? What kind of discrimination they're facing? And then there is the return phase, which is the impact of not only on the migrant and the family that moved, but also the ones that are left behind back home. Because if you want to look at it from a comprehensive point of view, then you have to also look at the impact on the wellness and the health of the people who are left behind. Some parts of the family who were left behind and were not able to migrate. There is a lot of cases that we saw from refugees who two parts of the family or one individual from the family will travel, leaving a wife and kids, or maybe the wife will travel and takes the kids and leaving the husband, or even leaving the mother and the extended family in back home. This creates definitely a lot of impact across these countries. The migration itself is increasingly recognized as an affecting factor of health. However, relationship between the migration and the health remains poorly understood, as all of you will discuss in the sessions of this conference. The action on migration and health remains limited. I have not seen a lot of studies that can be across the board, taken into consideration a regional perspective, a global perspective, because this does not impact one country. This does not impact the migrants of one country alone, but it does definitely have an effect on a region itself. And I think in order to immediately account for long-term and intergenerational impacts on health outcomes and migration health research, I think that there are 3 points that we should look into. We need to incorporate the different phases of migration, look into those, as I indicated in the figure that you can see right now. We need to adopt a life course approach, and we need to integrate a social discrimination determination of the health, the SDH approach. I think being a migrant in itself is not a risk to health. I think it is the conditions that are associated with migration that might increase the vulnerability of poor health, owing to ways which people move from one country to the other. They cross multiple countries maybe to reach to their final destination, but they can reside in places that are not very healthy. They can reside in urban slums, construction site, commercial farms, fishing communities, mines, detention centers. All of these constitute or lead to poor health and well-being of migrants. The daily stressors that the migrant might face and experience in these spaces affects the well-being and the health of the migrant and the family of the migrant. Here are some food for thoughts that I want everybody to think about, if I may. There are 2 questions that we need to ask ourselves in this conference. In my humble opinion, these efforts should take into consideration. What are the opportunities? What are the challenges and the essential components associated with developing a national, regional, global research agenda on migration and health? I think that question needs to be addressed. What are the approaches that should guide the development of national research agenda and data collection system on migrants and health? One of my recommendations is when we are discussing and emphasizing on international targets such as sustainable development and universal health coverage, I think this is unlikely to be achieved if the dynamics of the migrations are not better understood. To address this, and in order to improve the policy and programming, we need to renew focus on enhancing our understanding the linkage between both international and internal migration and health, as well as the outcome, the impacts arising from them, which is urgently needed. I think we also have to take into consideration that any intervention that we're developing, any recommendation that we're developing on the refugees or the IDPs, it must be from a holistic approach. You have to first identify the needs of the migrants to be able to come up with the recommendations. You also have to work with the host government. As I said, this is an integral and important component of developing any strategy for the migrants. Finally, I would like to say it is so easy for us to sit here and discuss everything that is related to a migrant and what it takes to travel from one country to the other, looking for a job, finding a better future for your sons and your family. But I think if we look at it from the migrant point of view, if we think about how the migrant feels, what do they need? What kind of assistance do they want? I think that should be the driving force that lays the ground for any efforts um, for a better future. Again, this is not uh, um, an issue or a challenge that one country faces. This is a global issue that is increasing day by day. Every day you find people leaving their homes, going to either finding a better future for their families or running away from instability, a conflict, crisis in their country. It is so easy to talk about that when we don't really know what a migrant feels, what trauma they're going through, what are the challenges they're facing on a daily basis that does not even cover the most simple, basic life rights, the human dignity. I would definitely urge all of you to put that into perspective when discussing any issue related to the migrants so that it can be the leading force that drives all the conversation so that we can have a successful outcome of this conference. Thank you so much for your patience, and let's hope for a better future across the board. Thank you. As you can see, we're a bunch of migrants in Blumont. It takes definitely a team effort to be able to assist all the vulnerable communities in the world. Um, this is us in Blumont saying thank you for hosting us in this conference. Bye.